Welcome, everyone. It's 2:10. Maybe we'll just go ahead and get started, and I think the rest of our first panel will show up before 2:20. So feel free to sit at the table. Can move closer. We'd love it. I'm Eileen Fauché, a member of the American Cancer Society's Board of Advisors here in Washington State and co-chair of the ResearchHERS campaign. I am deeply honored to be part of these important discussions about supporting and sustaining more women in leadership roles in cancer research. And I appreciate all of you who have chosen to take part in person and all of you who are able to join us online. I would like to start by acknowledging that we are on the traditional unceded land of the first people of Seattle, the Coast Salish peoples, including the Duwamish people. I want to express gratitude for the land itself and to those people past and present. There are a lot of reasons why starting with a land acknowledgement is the right way to go. One that I think is especially relevant to our purpose today is that it acknowledges that our social structure was founded on and is still pervaded by the belief that one group of people is superior to another. Only by acknowledging this and starting to name it can we begin to tease it apart and address it. Women are underrepresented in cancer research, from preclinical models to the clinical trials that serve as the basis of approvals through to the scientists leading and guiding this research. In acknowledging and addressing this, we are advancing the field towards better access for women and other underrepresented groups. I also just want to take a moment to recognize that we are in some terrible, challenging times with all the gun violence in our country, and better access to leadership roles for historically marginalized, underrepresented people is more important than ever. So what's my story? When I was a doctoral student in chemistry, there were times I felt like I didn't really fit in relative to the guys in my lab. I thought I would feel that less as I advanced further in my career, but it didn't really change. I started a postdoc in cell biology with 2 kids under the age of 3 and every intention of pursuing a career in academic research. But when you don't see someone that looks like you in positions of leadership in your day-to-day work environment, when you don't feel like you're part of the mainstream culture of the field that you're working to impact, it can really change your perception of what's possible. While in that role, I watched all of my female lab mates leave academia for careers outside of academic research. There's a sort of joke that cancer researchers hear often. We've cured cancer in mice thousands of times. This is an allusion to all the preclinical research that doesn't always translate to success in the clinic. What you don't hear often is that almost all of the mice are male. Pembrolizumab is an immunotherapy that was first approved 8 years ago, and it's now one of the best-selling cancer drugs, best-selling of any kind of drug in the world, generating $17 billion in revenue for Merck last year. The way it works is it takes the brakes off the immune system so that the immune system can gain the edge to fight cancer. There are a lot of trials that have served as the basis for pembrolizumab across a multitude of indications, and women are in the minority in nearly every single one. On average, women make up about 30% of the patient population in those studies, and in a lot of cases, it's less than 20%. It matters because the immune system of men and women are different. Females have been shown to mount stronger immune responses, which can lead to increased susceptibility to inflammatory and autoimmune disease. So let's talk about who's guiding this research, who's framing these questions, because how women and underrepresented individuals show up professionally is related to the larger picture of equitable care for patients. These are interlocking concerns. Lack of representation in higher ed and health leadership is one of the biggest systemic barriers to health equity. Next month, on June 23rd, it'll be the 50th anniversary of me actually, but also on June 23rd, 1972, Title IX was enacted into law. And Title IX, as you know, prohibits federally funded educational institutions from discriminating against students or employees based on sex. So why are women still underrepresented in leadership roles in cancer research? Men and women have entered medical school programs and graduate school programs in equal numbers for over a decade now. In fact, women have started to outnumber men in medical schools. But across the board, the gender gap grows with seniority. Why is this? A recent survey of over 660 women oncologists by Drs. Duma and Murfield and colleagues from the University of Wisconsin and published in JAMA found that most respondents perceived their gender to adversely affect job promotion. And more than 20% of respondents are considering leaving academic research in the next 5 years. That means we're trending in the wrong direction. The ResearchHERS campaign aims to change this. I hope you will join me in supporting this campaign, either financially or just by lending our voice and helping to spread awareness of this cause. As a woman in science who's experienced microaggressions and macroaggressions, conversations like the ones we're about to have here today uplift me, validate me, and motivate me. I hope you have that experience this afternoon. I hope you feel encouraged. There are inequities, but there are things we are doing and can be doing to address these. Gender is the equity focus of our discussion today, but gender intersects and overlaps with pretty much every other basis of discrimination, like race, class, sexuality. 35% of oncologists are women, but only 3% are Black or African American. Less than 5% are Hispanic or Latina. As a white person, conversations like the ones we're about to have bring me to reflect on my relationship with white privilege and consider how my experience with bias differs from other women's experience with bias. This is uncomfortable. But the change that needs to happen to make cancer research more equitable for everyone isn't going to come from a place of comfort. My story wouldn't be complete if I didn't add that I never would have made it through grad school in the first place if it wasn't for a fantastic mentor, a chemistry professor at the University of Washington named Martin Guterman, a white man who essentially sponsored me, and I'm forever grateful for his mentorship. I was not your traditional chemistry student. I know my nails were each painted a different color. I remember my hair was like dyed something weird. I did comparative religion in my undergrad, and he, even through all that, Martin saw potential. He took a shot on me, and that's what changed the whole trajectory of my career. Cancer research needs to be guided by this kind of partnership model, by a diversity of thinkers. To do this work, we need to involve everyone in these conversations, because the rising tide will lift all boats. When I'm not volunteering with the American Cancer Society, I'm the principal and founder of a strategic consulting firm geared to widen the lens for biotech and pharma companies. And I can tell you that in that role, the most game-changing teams that I've worked with are the ones that are re-envisioning how to treat cancer. Because science is less objective than we make it out to be. The perspective of who's asking the questions and who's interpreting the data, it matters. Breakthroughs have come from our ability to reframe our thinking and question our underlying assumptions. And this is the final point I want to kick us off with today. Cancer research is hard. Cancer researchers devote their careers to knowing a lot of very complex things. And when you're working very hard to fit into that culture, it can be really uncomfortable to speak up when you have a question. I used to think the smartest people in the room had all the answers, but now I think it's the ones that speak up and ask their questions. If you're uncomfortable speaking up and asking questions now, I encourage you to get comfortable, because the more that happens, the more we will shift to greater connection and ultimately the diversity of authentic contributions that we need to accelerate our research. So whether you're in person today or joining us virtually, I hope you'll join the conversation and ask questions. Share your thoughts. Use this friendly forum as a place to practice building connections and engaging with a community of people that share your hope for a more equitable, inclusive culture in cancer research. You're about to hear from some fantastic speakers about their work as cancer researchers and their personal experiences as trailblazers in advancing the field to greater equity and access. We are deeply grateful to our sponsors, BMS, CGen, and the Hutch, and I want to say thanks in advance to our speakers for lending your voice to this important discussion. For our virtual audience, you can submit your questions on the chat, and we'll do our best to get to them. For our in-person audience, you have to press the button on this little mic when you want to ask your question, and when you see the green light, that means go. If everyone would kindly silence their phones, we'll appreciate it. And now it is my pleasure to introduce my ResearchHERS co-chair, TK Francis.
Good afternoon, everyone. Hello. Hello. So I decided to wear orange today because several reasons. So thank you. I wanted to, we're here talking about equity and access, and to not acknowledge the moment that we're in. So I figured I could bring a little chair to the room. A little hope, that's what it is, right? Hope. So I'm gonna get started because we have 4 fabulous panelists and we only have an hour with them. And so I'm hoping that you will get a chance also to ask them some questions. So having said that, a little context, Eileen set the tone. So over the past year or 2, let's just say 2 years, considering this is the anniversary of George Floyd's death, over the past 2 years, we've witnessed the proliferation of public statements and strategic plans from institutions and organizations committing their support to advancing diversity, equity, and inclusion. However, many argue that transformative solutions require bold actions that are driven by intentional collaboration and authentic partnerships. And so I want to set this conversation with 2 reflective questions right now. How do we leverage partnerships and resources, provide supportive learning and working environments for women in cancer research? And how do we leverage partnerships and resources to advance equity in cancer care, research, and beyond? Quickly, I got that from Fred Hutch's site. And lastly, to add to what Eileen said earlier, the reflective question, how are we going to operationalize our equity-focused work from your own sphere of influence? So how are you going to lead this work? Interestingly, 2 days ago, I was on Twitter. I'm a Twitter fan. Well, I don't tweet a lot, but I observe what's going on. And saw a tweet about one page from Octavia Butler's Parable of the Soul. And there were 5 questions. Where are we going? What kind of future are we creating? Is the future you want to live in? Is this the future you want to live in? And what can we do to create a better future? Individually, as groups, what can we do? And this was written in 1988. Kind of prophetic, right? So the context here is cancer research. So without further ado, I'm going to ask each of our panelists to take 1 to 2 minutes to just introduce yourself in however the way you want to. If you could give us a little bit about your educational background, right, and why, and your research. Sorry, I watched the time. So I'll start with Kemi. You want to start?
Does that work? That works fine? Okay. My name is Kemi Dole. I'm an associate professor at the University of Washington in the Department of Obstetrics and Gynecology, the Division of Gynecologic Oncology. I'm a gynecologic oncologist. Right now my practice is at Harborview Medical Center. And I'm also a health services researcher with a focus on outcomes for Black women with endometrial cancer in the United States. So my research spans from kind of large population level data analyses to small intimate interview studies with survivors in the advocacy community. What else did you want us to talk about?
That's it for now.
That was
Just
good?
a little
Okay.
intro. Yeah.
Hi,
Yeah.
happy to be here.
They have the bios, but I just wanted you to write just a snapshot
Okay,
for the people who are virtual.
okay.
There's so much more to you, though.
I mean,
Hi, everyone. I'm Julie Graylow. I am currently the Chief Medical Officer for ASCO, the American Society of Clinical Oncology. I spent over 25 years on faculty at the UW and the Fred Hutch as a breast medical oncologist and also a professor of global health at the University of Washington. And I actually technically retired 15 months ago. I shut down my clinical practice as I took the Chief Medical Officer role at ASCO. And my job is based in Alexandria, Virginia, although I'm here about 3/4 of the time, at least during the pandemic, but travel's picking up. I've been a breast medical oncologist, a clinical trialist, spent a lot of time as vice chair of the breast committee and then executive officer for breast and lung cancer for the SWOG National Clinical Trials Network. And at ASCO as CMO, it's interesting. It's hard to explain exactly what I do, but I'm the chief medical spokesperson, but I oversee, in relevance to this particular meeting, one of the 4 departments I oversee is our Center for Research and Analytics. And we've got about 30 staff there. We're running a big genomics matching trial. And as I think about this meeting, all of my leadership in that department is female. So I didn't really dawn on me. It just seemed like a natural thing until I thought about this meeting. So got some great female leadership there.
Thank you. Good afternoon, everyone. My name is Chris Lee. I'm a faculty member here at Fred Hutch. I'm an epidemiologist. I don't have to explain what that is to anyone anymore, since everyone now knows what epidemiology is. Thank you, COVID. But my research is not infectious disease. It's focused on cancer. I focus primarily on breast cancer and colorectal cancer, and really do a lot of human studies that span the continuum of cancer prevention, screening, early detection, and survivorship. And I also serve in a role here as the Vice President of Faculty Affairs and Diversity, where I lead our diversity, equity, and inclusion activities focused on our faculty.
Thank you. Hi, everyone. I am Shachi. I'm an assistant professor at UW's Department of Chemical Engineering, so very different flavor. I'm an engineer by training, but passionate about cancer research. So my work is focused on how we can use innovation in imaging and data science to understand cancer better, and particularly with respect to what we're talking about today, is how do we build technologies that can help us in resource-limited settings? How can we build technologies that are helping us address the sampling bias and understand about the diversity of cancer in much more detail? And my focus area is breast cancer. Yeah.
All right, thank you. Just a note, I know we don't have a mic. They asked it for the audience, if we could speak a little bit louder.
Maybe I can't tell if
Yeah.
I'll lower my mouth.
I don't have one.
Maybe.
Sorry. Okay, another warm-up question. And we'll start from the other, end. Is that okay, Sasha?
Yeah.
So why are you all passionate about cancer research? And why did you pursue, why did you pursue a career in cancer research? And if you want to, you could talk about who or what influenced this decision. I think that is important, your positionality to the work. I think, tell us a lot.
Yeah, so for me, it's kind of been a mix of professional and personal experiences. So in my high school as a kid, I really used to like math and biology, which was at that time, people didn't understand it was contrast, and they were like, oh, do you want to become an engineer or do you want to become a doctor? As a female, I used to get challenged on math quite a bit, that because you're a woman, you cannot be good at math. So that kind of just made me have a fire to just be more good at it. And that was my way to answer people. So I kind of decided to go into engineering, but I was always wanted to do something that is driven by human impact. So I decided I'll be a social entrepreneur instead, and because I couldn't find how I could connect research, which I liked, to social impact in that year. And then I got to do an internship during the last year of my undergrad, where I was building models on detecting cancer. And that's where I felt like this is my mission. This is where I can connect my love for academia and my passion for social impact. And that's how I decided to be in cancer from a professional standpoint. Personally, I saw a lot of people around me, close to me, get affected by this disease, where they couldn't really understand much, didn't have the resources from a medical standpoint to understand much about the disease. And that's where I remember when I just started my research journey, probably more than a decade ago, I ended up asking somebody, well, can't we do something that cancer just becomes like a fever, where we are able to address it and not be scared of it? So that simple question, that naive question, is still something that motivates me today to get closer to anywhere to that question. Yeah.
Thank you. I think for myself, when I was in college, I was very focused on just wanting to become a doctor, go to medical school. I had volunteered in different hospitals and really enjoyed that type of work. And I never even thought about pursuing a career in research. It was actually the summer after my first year of medical school that I came to Seattle and did a summer internship in epidemiology doing breast cancer research. And that's really what kind of sparked my interest in completely shifting my focus. And so I ended up, I finished medical school, but I never did a residency. I don't have a license to practice medicine, but decided to just go full-time and pursue research because that's where my passion really lay. I think it's similar to you, was trying to do work that would have an impact. And I think very early on in my career, I became engaged with a large number of breast cancer advocates, and that really helped kind of guide a lot of the work that I did initially. Obviously also, I think probably almost everyone's family has been impacted by cancer. My aunt died of breast cancer. I've had several other relatives who died of different types of cancer. And so I think there is this kind of personal motivation as well to try to make a difference. And for myself, I feel I can have that greatest impact through doing research.
So I entered college thinking I was probably pre-med, not 100% sure, but took all the classes. And as I was nearing graduation, I thought I would get some experience in a lab. And just totally coincidentally, I didn't seek out a cancer lab, but I was hired as a research tech in an oncology lab. And I basically made hybridomas and made antibodies. And I was in a great lab where some of the antibodies we made were some of the first to be infused into humans in B-cell lymphoma patients. And one went into a complete remission. And here's this little undergraduate thinking, this is the coolest thing in the whole world. I mean, how much more obvious was the link between what we did in the lab and what I saw could happen in a patient? And that's a very rare experience, by the way. So now all of a sudden I'm like, oncology. I applied to med school. Everybody was so mad at me that I knew what I wanted to do from day one, because all my peers in med school were struggling with what they wanted to do. From day one, I'm like, cancer, cancer, cancer. And then how many more years of training later, 12 years later, I became an oncologist. And I never looked back. I always, thought the research that was done in the lab needed to be then implemented into clinical trials. I thought when I was in fellowship here that I would have a lab. That was just the model I saw. That was what I saw in my mentors. And then when I started getting into clinic and really getting to know my patients, and I realized I wanted to be a really excellent doctor and also having a full-time lab. That wasn't going to work, but I could do clinical trials and still have a much stronger connection. So that was a little surprise to me. I thought I would be just like my mentor who had a big lab. And I loved the clinical trials piece, which that means partnering on both sides, right? With the clinicians and with the basic scientists, as well as occasionally with the epidemiologists. Chris and I did lots of stuff together. So that's how I ended up here. And how I ended up in breast cancer, seems like we're very women's cancer. We're all women's cancer up here. I thought I would do lymphoma, of course. That's what my mentor had said, And I joined a lab And when I joined the lab, they said, we have 3 projects going on with these 3 different genes. And I picked this interesting new gene called HER2, that there was some association with aggressive breast cancer. And we didn't know anything more about that. And so I picked that project. So then I started growing a clinic of breast cancer patients. And I thought I really bonded with them, and I liked breast cancer. And so that's how I ended up in breast cancer.
Okay, so our stories are so distinct. It's so interesting. So I was an engineering undergrad, and I thought I was going to be an engineer. And then I realized that I did want to have a closer connection, like kind of people, what I would have said at that time, like I want to work with people a little bit closer than on teams. And so I ended up going to medical school, and in medical school, I loved everything, but loved OBGYN the best. I think I just fell in love with the reproductive system, and to me, it was just like absolute magic. Like the fact that nobody could answer my question of how does labor start on its own. Like this is like, we don't know anything about ourselves. So I went into OBGYN. I actually had no experiences in cancer and gynecologic oncology in medical school, so I didn't even really know about it, which is really a shame. A lot of medical students, a lot of trainees go through their entire training and they don't even find out that the field of gynecologic oncology exists. There's only about 1,300 gynecologic oncologists in the whole country, and the statistic is between 1% and 3% are Black. So just in terms of your quick math, that's literally 15 to 45 people, and I can tell you it's 36. So when I went into, and that's total, that's not academic. And then within academic, that's not academic who do research. So so it ends up being a handful of us that are Black gynecologic oncologists that do research in this country. And the reason why I say all that is because it might give you a sense of why, when I went through OBGYN residency, then I decided to do GYN oncology, and I'm in clinic and I'm training, and I'm seeing these absolutely horrible disparities for Black women with gynecologic cancers, and specifically endometrial cancer. And I'm asking questions like, what is this? What's going on? Why is this happening? And the answers are basically, it's complicated, and that's just the way it is. So to give you a sense of how critical it is to have representation among our researchers. So I decided to become a researcher because I wanted more Black women to survive the cancers that I saw and took care of every day. I mean, that's my entire drive was, this seems like a tool that needs to be employed in order to help more women live. And my clinical experience was between a very well-off hospital and then a public hospital in Chicago, in a big city. So I was really seeing every day just how stark the difference in quality of care was, even when the providers were the same, and all of the attendant issues that went along with that. So when I went to fellowship, I decided to get training. And I got a Master's of Science in Clinical Research degree, which is essentially, it was a 2-year program that was really designed for people like me. So physicians who are interested in doing some aspect of health services or public health research. I'm really grateful because it was such a high quality program, and it gave me the skills I needed to start to do some of the population level and patient-reported outcomes and more intimate studies to understand what's going on for Black women with endometrial cancer. So that's how I got into research, and it's just been so rewarding because my approach is that I'm interested in any method that helps more Black women survive. And so I have my own areas of expertise, and I partner all the time with other people who have other areas of expertise, so that we can move from saying it's complicated to actually starting to dissect out the different pathways of why Black women end up with a 98% higher mortality in the most common gynecologic cancer in the country.
Thank you, Cami. That was the perfect segue to the conversation. So for context, I didn't introduce myself. So you have my bio, so I won't take up the time because we want to hear from the experts. I'm a postdoc in the chemistry department at University of Washington. I'm a STEM educator, and my focus is looking at, I want to know, how are we going to retain people in this environment? How are we going to make this space inclusive? And so I know Eileen spoke a bit about the theme. You know, we talk about diversity a lot, but I think two key things that we don't really emphasize is equity and access. And I think all the panelists spoke to that in some way. So what I did, because I remember Orange for the Future and Hope and the questions that I asked, I tapped some young researchers, cancer researchers in grad school through early career, and I asked them to give me some questions. And I think, you know, if we're going to begin reconceptualizing or rebuilding or thinking about the leaky, whatever you want to call it, the pipeline, I think we need to hear from them because they're observing and they're listening to their mentors and they're making decisions. And so I'm going to start with some of these questions, if you don't mind. So, woman of color, what is your institution or organization doing to support and retain talented investigators? And I'm going to say also, if you're doing that within your research, you could speak to that as well. And I'll expand it a little bit because there's a part two, like, right, you know, what contribution has your institution or organization made towards patching the leaky pipeline? So it's about retaining. So Kemi gave us some stats, right? She said, hey, here's this number, but everybody's not in academic medicine. And for context, this person that asked this question, highly considering, extremely talented, saying, TK, I want to go into industry because I don't know how I'm going to survive. So how can we convince, she has 2 more years on her postdoc, how can we convince her to be in this space that you are?
I'll start. So I think I'm not sure that I'll answer the question of what my institution is doing, because I think institutions need to answer those questions. But what I'll say is that I think that it's important to have the framework that I think about with this question of pipeline and retention is to really start with the awareness that the current pathway and the current structure was never intended for women or underrepresented minorities, especially women who are underrepresented minorities to succeed. So it wasn't built for that at all. So I think when you start there, it helps you have an orientation to think about how every single step along the way might need to be optimized or adapted or somebody supported through, because they are probably navigating and having to navigate around more than really what the system was built for. So I think that's really important, because sometimes we do one thing over here and one thing over there, and we expect there to be change. And so I guess the other way I'll answer this is a little bit with my own personal story, which is that I actually, even though I love my engineering program, I failed out of college. So after my first year in college, I did okay because there was enough material that overlapped with some of the stuff I had in high school. I mean, I can tell you this now. At the time, I didn't understand what's going on. But there was enough material that overlapped that I basically got by. But then once we got into new materials that I hadn't seen, I had so many challenges, and I basically I failed out. Like, they wrote me a very polite letter that said, you have not passed enough classes and we would like you to leave. You can reapply in the future. So I had to reapply, and I reapplied, and I changed a lot of things about my approach, and really had to circumvent a lot of the culture, right, which was that I was one of 5 Black students in the entire School of Engineering. And there was a lot of isolation involved with that. And I didn't understand that, you know, everybody was studying together, and nobody was doing anything by themselves. And I was sitting there trying to do everything by myself. Like, all these things I just didn't understand because I wasn't tapped into the mainstream. So I did that. But if you imagine how GPAs work, like, when you have a 0.0 semester, you're never going to get a GPA that the top schools want to look at, even want to see. So if there wasn't a process at the school I applied to that said, let's not only focus on this GPA number, let's look at people themselves, I would never have gotten in. They wouldn't have read my application at all. I was 2 standard deviations below their GPA requirement. So I ended up getting in, but the other reason is because I did a pipeline program. So there was a summer in college where I was able to do a pipeline program that it's changed its name now. At that time, it was called the Minority Medical Education Program. And so I spent the summer in a medical school, basically doing medical school which is the only reason that I believed that I could do it. Because I just felt, I was like, I'm not smart enough. So because I did that program, then I believed I could be smart enough to go to medical school. I did well in the program, so then I was able to get letters that say, hey, she did 6 weeks of med school and she did okay. And then the schools I applied to, some of them clearly did not do anything but look at my GPA because I never heard back from them. And then some of them did, and so then I got into an Ivy League medical school because they had more holistic applications. And then I went to medical school and I did really well. And I say that not to brag, but just to say how incorrect some of those things are. So I honored in all my rotations. I got all the academic awards. I figured out how to study in a group. I figured out all that stuff. I did really well, and now people look and they're like, oh, look, she's so successful. But I never would have been a person to retain if that pipeline program didn't exist, and if somebody didn't look and say, maybe these entry criteria aren't actually the best at identifying, people who could succeed. So that doesn't really answer your question, but I wanted just to be able to give context that behind any potential woman or woman of color, underrepresented faculty, there might be things that we see as dings, or maybe they can't do it, or they don't look exactly like this person or that person, but all of our criteria really weren't built to be holistic in that way. And so that's why I think that, like, along every step of the pathway, we need to rethink how we move people forward and what we define as excellence. And I'll give other people a chance to talk, and I'm happy to talk again about some of the things that we're doing for faculty at University of Washington. Thank you. Sorry, that was long.
Thank you so much for sharing that, Kemi. That's, I guess what I was thinking was, that's kind of brave to come out and tell us about that. But I think that's really important for people to hear. The more senior I get in my career, and people look at me and say, I want your job someday. How do I get there? And I think back on all the papers that were rejected, all the grants that were rejected, all the jobs I applied for that I didn't get, all of those things along the way. Nobody sees that. They don't see those negatives. And I think it's important to know that that happens to all of us, and just continuing to try and make the best of where you are, but keep pushing if you really, really have a dream, right? So I think that's part of an answer. So you asked, what are our institutions doing? I'm thinking about this a little bit in two ways. One, the American Society of Clinical Oncology has 500 staff, and that's a lot. And we're actually pretty split, 50-50, male-female, but we have a huge effort. We took our director of equity, diversity, and inclusion, and within the last year promoted her to the vice president level and gave her a couple staff, and we're doing this. And just earlier today, I'm the leadership sponsor of our workforce EDI efforts over the next 2 years. So we're having, how do we get this? And it's equity, diversity, inclusion for everything. And I'm like, are we even sure that this list we have, which is, ethnic, racial, gender, LGBTQ, disability, I'm like, I am sure there are people out there who think that they are an underserved group of another kind that we haven't even thought of. So maybe the first thing we should do is just get a sense of how people are identifying themselves so that we can try to include them. Like, we have people who work remotely even, and they feel differently than people in the office. We have people, who are immigrants and from, English isn't their first language. So anyway, we have a huge effort to try to, walk the talk. With respect to our mission as a professional society of oncology professionals to, grow the next generation and support the next generation, we also have a lot of efforts, and we're here specifically talking more about the female support. We have a Women Who Conquer Cancer group where we have specific grants, mentorship awards, other awards just given out. At the annual meeting, which will be next week, I can't believe it, in Chicago, first person-to-person kind of meeting in a long time, we have a women's networking lounge. And you can sign up, and I did this in past years where, a bunch of people give a couple hours of their time, and then other women can see who's got slots and pick a half-hour slot to talk to somebody who's agreed to give their time. And that's what's so fun, you know, because they've kind of selected you and you just get to talk about life and general stuff. And I've kept relationships with several of those people, and we're going to have some events there. And, you know, there was a recent poll, I think we heard about one, but in the general medical workforce at the physician level, at least 20% of women in a recent survey in the US said they were thinking of leaving their job in the next 5 years. And that was much, much, much higher than men too. So this gets to all of the other issues of these jobs, these positions, the academic positions and all. We've built it for men, and we've got to now be more innovative, more creative. I was, in my last year, before I quote unquote retired from here, I was on the Professors Review Committee, which is you review everybody who's up for promotion to the professor level. And I was looking at some of the divisions, because this is Department of Medicine, some of the divisions had very creative ways of giving credit that weren't the traditional number of publications, number of grants, et cetera. They had other ways of giving credit for service and things like that, and mentorship. But my division didn't. It was pretty classic. You have to have at least 25 publications to do this, and this, you know, many grants and all. And so, you know, I started speaking up and saying, you know, we're all different and we're all adding value. And somebody who's over here doing things that are adding incredible value, that they don't meet traditional criteria, they should get points for that. And we have to figure out why. So anyway, we do need to do that. We all add value in different ways, and we have to figure out ways to reward that, to bring up junior people so they don't think that they have to work 80-hour weeks and, you know, like the crazy stuff that we used to do with all this call back to back and everything. I think we just have to not accept what's out there and think outside the box and recognize value that's outside the classic structure.
Thank you both for your thoughts. I mean, I think recruitment and retention of diverse scientists is basically my job here at Fred Hutch, so it's something I thought a lot about. And I think the framework that I use is really thinking about the different levels of oppression that we know exist, and kind of we need to have interventions at all those levels if we're going to ultimately be effective in the work that we do. And so kind of at the highest level, there's the structural layer of oppression. And so for us, that's really been, how do we recognize the kind of structural inequities that exist with NIH funding, which we know is biased towards certain groups or against other groups in our review of faculty? How do we look at our academic policies, faculty policies, through an anti-racist lens and make changes that will dismantle some of those structural biases that we know have existed in the system, you know, basically since the inception of the institution? How do we think about our policies and practices with respect to faculty recruitment, in terms of how do we identify candidates, how do we promote our job postings, how do we review applications, and really trying to disrupt that in a way that also kind of dismantles a lot of these structural barriers. So I think that's one layer that we've spent a lot of time focused on. The next is more kind of the institutional cultural level, in terms of how do we you know, mitigate bias that we know can exist within our institution. How do we provide education in a way that kind of meets people, all of our employees where they are in this kind of journey? How do we have kind of open discussion and forums when complex issues arise? And you know, how do we kind of promote a culture of respect and what's ultimately a goal towards inclusive excellence? And so having a number of different strategies to support that. And then I think there's the interpersonal and personal dynamics that exist. And I think for us, it's really been a focus on our faculty from underrepresented backgrounds. We recently completed what we call a cluster hire search, where we recruited 8 new faculty to the Hutch, all of whom are from underrepresented backgrounds, all of who entered the institution at the same time. So I meet with that group monthly, where we kind of provide education around kind of how the Hutch works, but also it's a space to talk about a number of the issues that we know particularly impact and can impede the progress and career development of faculty from diverse backgrounds, such as talking about concepts like stereotype threat and hypervisibility, feelings of isolation and whatnot, and providing a community to have these types of discussions. So really, I think we have to be looking at it at all these different levels if we're going to make a meaningful impact.
Yeah, I think I'll just basically add a little bit to what everybody said here. I think there, like in terms of retention and in terms of supporting people from diverse backgrounds, I think it's 4 pillars. It's about training, it's about opportunities, it's about support, and ultimately it's also about recognition and also about kind of accepting what those soft skills are, so which is evaluation, right? And I think to be able to understand that what we need to do in each of these pillars is to really enhance our understanding of what equity really means. Equity is not just equal opportunity, it is an equal position to succeed, right? So that's where we need to think about that if you have provided an opportunity and there are 2 people in the room and they both have the opportunity, is the system designed to give them the opportunities in a way that they can both succeed in that position equally? And obviously, there is a dependence factor of the individual itself, which the individual has to focus on. But what we can focus on as a group is about the system, about the support, about the environment. How do we do that where individuals are positioned to succeed? How do we train to boost that confidence? There are so many positions that female faculty don't even apply for, even if those opportunities exist. Like, I'll give you my example. I didn't plan to apply for faculty position because I thought maybe I'm not ready yet because I need more. So I've always been that critical evaluator of myself, where even when I was top of the class and everything, I would still say that this is not enough. Somehow I needed to do more to still be at the same level, right? And some of it was self-induced because of what the thinking process of the society was, and some of it was systemic, right? And then I had mentors who literally pushed me, like, we don't see how somebody can be more ready, and you need to apply, right? And if it hadn't been to that, I wouldn't have applied. So the opportunity was there, but the training and the support for me to even exercise that opportunity had to be there. Right? So I think that's what we need to think of, not from just institutions, as UW, or any other institutions, but also people. How do I do that for my students? How do I do that for my students in class as researchers when I interact with collaborators, right? And I think that's the piece that I would leave you with, is how do we think about training, opportunities, support, and holistic evaluation. And yes, one thing, because Chris mentioned about hires, right? I think in terms of evaluation, we really need to be able to develop a technique of understanding soft evaluation. Like, what are the soft skills that you're evaluating? Because sometimes even when you create positions, and let's say if you hire 8 people, you have to kind of build a system where nobody in the entire pipeline is able to tell them you were hired because it was a diversity hire, because that just removes the point of it. And you can only do that when we are able to deeply understand the soft skills that that person is bringing and enhancing to that team, and to quantify that so that we can tell it to the people that this is still because of talent and not because of diversity. And that talent will lead to diversity. Yes.
All right, another question. As cancer scientists, we all need access to resources to achieve our research goals. And sometimes those resources are unequally provided to women, whether it be financial, equipment, staff, or other opportunities. Do you have any tips for self-advocating to ensure you're provided the resources you need for success? And so, Chris, I think it will flip for you in your role right now. What would you recommend these young investigators do? Feel free to share how your organization and how you're doing that in your local space. It could be with your research as well. I could start in the middle this time. Or Kim, you want to go?
Yeah.
Okay.
So I have a lot to say about this, so I'll keep it short. I think that advocating for the resources and the things that you need to get your work done is a skill it's a skill that there should be an expectation that that skill is taught and nurtured and coached among faculty members. And so we have a program, UW also has a program, School of Medicine, which is a faculty development program for underrepresented faculty. And one of the things, one of our sessions is kind of focused on how do you advocate for the kind of things you need within a rigid, what appears to be like a rigid system where these are the rules, this is what everybody gets, this is how we've always done it, et cetera. So I think there are a few things. One, I think, is specificity with your needs. So sometimes where early career, often faculty start is just kind of like, I need more money. And I'm always like, that is great. To do what exactly? Or I need more time. That is great. To do what exactly? So I think that when you're able to communicate not just that you need more resources, but what is it specifically that you need, and then what will those resources allow you to do, you create a conversation around shared goals. Because if you've hired me on as faculty, then you want me to succeed. Now I'm here and I've done a needs assessment and I recognize that these things I can succeed in, but these things I can't without XYZ resources. And so now we're just talking about how we're going to close that gap so we can have a mutual goal of success, as opposed to where I think the conversation can really go off the rails, which is kind of about, well, what we've done before, well, we've done this, well, we've done that, because there's nothing that gets me more frustrated than the conversation of, we've never done that before. Because, like, I mean, yeah, that applies to, like, almost everything good that's ever happened. So, so I tend to, in my role as helping people in my role as URM faculty development director, I tend to help coach faculty on how to do that kind of clarification work first, around what they need, what they're trying to do, just the specifics around how these resources will close the gap. So then they can go in and they can advocate for exactly what they need. And so I don't know, that's what I add to the conversation. In addition to, of course, like, yes, you should ask, like, absolutely, like there's nothing wrong with asking. And then the last thing is just to remember that, going off the prior comment about recognizing how, these systems are really not, like, the default of the system is that women are paid less. The default of the system is that URM faculty will not last at the institution. Like, I think about that framing, that if we allow the default to go, we should expect our URM faculty to leave, and we should expect our women faculty to get paid less. So if that's the case, then it makes sense that we are on purpose thinking about, how do we help people advocate for salary increases? How do we help them advocate for raises? How do we think about retaining a community for the URM faculty? Like, we're constantly thinking about buttressing against the default. And that is not outside of all the systemic change that needs to happen. I think it's important to put that into context. But I also want to build up individual faculty members to know that no matter what environment they're in, they know how to advocate for resources that they need.
So Kemi's the real expert here, and if you follow her on Twitter, you'll see that she is a coach, and she's out there, yay, you go girl, and she's out there doing it. So she's the expert here. It is in many ways my role model in terms of showing the support and all the backing. We aren't taught how to negotiate, and that's, but you've got to do it, and you have to learn, and you can't be timid. For some reason, Don Berwick's, the moral test, it was a speech he gave. I was given this when I was a fellow, and one of the things, he talks about the relationship between institutions and faculty, and one of the things that always stuck in my mind was, your institution doesn't love you back. And no matter how much, you love your institution, so ask and give. They're not going to come out and hand it to you on a plate unless you've got another job offer, or, you have something to negotiate with. And we've had a lot of talk about the difference between mentorship, sponsorship, and allyship, in a way. So your mentor is the person you're intimately involved with your research and all, but seeking out sponsors who you don't interact with as much, but they're people who you respect and you like their opinion, and you ask them even just a couple times a year, can I run this by you? I'm looking to do this. And part of the sponsor's job is to look for opportunities for you. too. I don't really do a lot of direct mentorship anymore, but I do a ton of sponsorship, you know, where people I've interacted with all over, I'm looking for opportunities, I'm putting them on committees, I'm nominating for this, I'm, you know, having just coffee with them every once in a while. And so I think what I tell people to do is, if you see somebody that you view like as you'd like them to be your sponsor, reach out and say, hey, I've been following your work. I could really use a little advice. Would you be willing to have a half-hour phone call with me? And you know what? You'll usually get a yes. And that person can sit back and think about it and help you. So that's another, I can't remember what the question was anymore. I've gone so far.
How you advocate for me.
Yeah, how do you advocate? I mean, I think having not just mentors. I never had a female mentor, but I definitely had female sponsors and role models and all of that really helped me, that were strong and convinced me and said, do it, you know, and just stick your neck out and do it. And what's the worst that can happen? They can say no, right? So.
Yeah, this question actually reminds me of a documentary. I don't know if people have seen it. It's called Picture a Scientist. It's a documentary that tells the story of 3 women scientists and a number of the struggles that they had. And one of the scientists who is featured in that documentary is a very well-renowned scientist from MIT. And she was the one who actually, her instigation led to what was the kind of famous MIT report documenting clear disparities by gender in the institution that I think reverberated throughout academia and led to you know, pretty seismic change in how resources and things are allocated. Not to say that it's all been corrected, but it basically shows her literally, you know, this famous scientist walking around MIT with a yardstick, measuring the sizes of different labs and how all the women had substantially less space than all the men. And so I think kind of bringing it here to the Hutch, that led to an evaluation of our dynamics in terms of gender distribution of resources and space, and actually found that we didn't have the same types of discrepancies that we're seeing at other places. And I think part of that comes to, you know, sort of institutional values to a certain degree. And I think at least at Fred Hutch, equity with respect to resource allocation is something that has been one of the founding values of the institution. It's a place where, you know, space is allocated equally to people based on their academic rank, assistant, associate, or full professor, and it doesn't vary. So, I mean, we've had, you know, several Nobel Prize winners here at Fred Hutch. They get the same amount of lab space as somebody who never will get a Nobel Prize, to be very honest. And that's just part of the ethos of this particular institution, where it doesn't matter what you've accomplished. If you're a faculty member here, you get the same space and resources as everyone else. And so I think that kind of makes, you know, provides that framework where everything is done through an equity type of lens, at least in that terms of resource allocation.
Yeah, and I'll just briefly add, I think to be able to successfully advocate for yourself and negotiate, you need to first believe in yourself. To get something from the table, you need to first understand what you bring to the table. And I think that's the confidence that we need to build in ourselves, to really understand that what is it am I bringing and what do I need to successfully bring that to that institution. And the second thing, which is kind of related to this first thing, is we have to also kind of understand that when we achieve something that we have never seen a precedence of, like if I'm the only person in the entire family or far away to just become a professor, trying to avoid that mindset that, oh, I am so lucky that I got here. Yes, I am. But also realizing that based on what I've achieved, what I can bring to the table, the institution is also lucky to get me. That's when we start in the mindset of asking something. Because when we think that it's only the institution that is making us lucky by providing us something, then the negotiation has stopped, because we already got what we even didn't think about we will get, right? So that's my 2 cents on this. Yeah.
Just add something. What I tell my faculty is that you are a rare resource, and in any other situation, any institution, there's a rare resource. Any other situation, institutions are like, ooh, we got to go after this rare resource. We got to invest. We got to keep this happy. We got to get this machine. We have to get this particular type of expertise, et cetera. And like, you need to understand that while we're on this path of increasing representation and fixing the pipeline, that there are very, very, very few of us that get to this level. And it behooves your institution that you do well because your impact is so outsized because of the hypervisibility. So it's not just that you're successful in your career. If you are successful in your career and we're dealing with the numbers that we're dealing with, you're impacting the entire pipeline. You're creating all of this possibility for people. All of a sudden you have diversity in the trainees. All of a sudden you have more community partnerships, which raises the institution's visibility among patients, which changes their reputation in a community, et cetera. So, and that can the result sometimes of a single person in the department that wasn't there before. And so that's how I also access this place of pride and value for our URM faculty, because they do deal with a lot of stereotype threat. They do deal with a lot of people looking at them as the diversity hire, which like I'm almost considering like a curse word these days because it frustrates me so much. They do deal with this constantly, and they have this, I find that they have an extremely high internal standard for themselves. I haven't met a single woman of color or URM faculty that has too low of standards, that is underperforming because they're too lax. They all have, it's almost like detrimentally high expectations because they desperately want to prove that they belong. And that becomes corrosive because it's exhausting. It's absolutely exhausting. And so the more that they can understand how outsized value that they have, that their science matters, that their perspective is valuable, and that just by being successful as a faculty member, they are doing so much, the more that they also believe in themselves and will ask for what they need.
All right, wow. Do we have any questions from the audience? I just want to, you can at any time. We have about 10 minutes, 15 minutes, just let me know. Mentorship, sponsorship, allyship. So I'm just reflecting on the remarks. And remember the question that I posed to you all, what can you do from your own sphere of influence? And I think each of the panelists gave us some examples. I want to add another role, if you don't mind, and it's being an accomplice, right? And so, for me, like Julie, for me, sponsorship is what got me into rooms, right? Sometimes I'll just see an email, hi, TK, I want to introduce you to this VP. I'm like, whoa, they didn't even tell me, right? It was because somebody said, if I could get you in the room, I know you could do the rest. And so I want to pose that to all of you, what can you do? Remember, I'm on Twitter, you might not, don't follow me, I'm just saying. But it made me think of a tweet that I saw yesterday, just simple exercise. If you're an accomplice, you will share your salary, info, and or offer letter with people of color who want to ensure they're getting paid equitably. That's something that I think all of us could do, right? So if we're talking about recruitment, helping them with that process in the advocacy, right? Just throwing out some things, you could do that. All right, I don't know if it's a fun question, but we're talking about resources. And if a donor gave you $20 million today, and you could do what you want, 2 areas. So it's a vision question, right? What would you do to advance women cancer-led research, and then your area of research and or field? So it's twofold. I'll let you pause. Do you need more money?
200 million?
Yeah, I'm a physical chemist by training, material science. I don't know how much money you all need, but I figure 20 million is a lot. I see the grants. Yeah, I see 6 million, NIH, I see these grants. I said, let me give you 20, right? So 10 for leadership development opportunities. That's what research is about, right? We want to, advance women-led cancer research. And then the other piece is, to speak into what Sashi mentioned, yeah, we want to get you in a room, but you are researchers, right? So how are we going to help you? So where's your field going? So Kemi, Sashi, you're in AI, right? and there's breast cancer and endometrial cancer. Like, if you got that money right now, and you could do whatever you want. So there's some people in here, they might have some money. Might not be 20 million, but we could get it.
Thank you. I can't even get the red light to go green. So my first reaction, so I'll give you two different answers, because my first reaction, since over the weekend I was in Geneva at the World Health Assembly, which is just so amazing to be around a bunch of people who all really care about the health of the world. And we were launching an Access to Essential Oncology Medicines initiative. And I would put that 20 million into that and build that program. So, because that's still right on my mind, and I think we could cure hundreds of thousands of people tomorrow if they could get the same standard of care that we've already proven and we have evidence for. So that's number one, because I think I would be happy to die tomorrow if I could even make a dent in that. But you asked about leadership and the development. So, so what I would do if you restricted it to leadership and development would be, we have at ASCO have a leadership development program that's been in existence for probably 12 years. It's hard to get into, but it's great. And if you can get into it, then you are set for life, because you made all these contacts and you get on ASCO committees and you get all this stuff. So we're trying to now model that and branch it out. And we are creating leadership development programs for different audiences. So we have regional councils right now in Asia Pacific and Latin America. So we're doing a leadership development program in each of those areas. And just in Geneva, we kicked off a women's leadership development program through something called Cance City Cancer Challenge. But it'll be all women from a group of cities in low and middle income countries. And we've also talked about a clinical trials leadership development program. It's not teaching you how to do clinical trials, it's teaching you about the leadership piece of doing clinical trials. It's not the biostatistics part of it, but more, the broader leadership piece. And we've talked about an education-focused leadership development program. So we're coming up with all of these ideas that we can use some of the pieces of our classic leadership development program that people love so much, to give you the skills about negotiating and strategizing and being accomplices and, all of that, but also with a specific focus. So I would put it into all of those different leadership development programs and maybe have them tailored to different, even more tailored to different groups. That's what I think I would do.
So I want to start with saying that this is not my complete answer, and I reserve the right to revise. I think one thing that happens to that has been happening in the clinical training space is that there's this recognition that it's ridiculous to make people spend 15, 20 years just to train to get to become a certain specialty. So you see more and more in like cardiothoracic surgery, neurosurgery, these training programs that would just last forever, that they start to do these kind of like highway, like these pathways to the field. So once you graduate medical school, instead of doing 5 years of general surgery with 2 years of research, and then you start neurosurgery, like you just come in here, do 2 years of general surgery, and we'll get you right in and start your training. And I think there's a recognition there that they understand that you don't need to jump through these hoops. That if we're clear, you're clear on what you want to do, we're clear that you would be excellent at this. Why are we going to make you jump through these hoops that are not necessary when we can kind of get an amazing clinician out earlier? And I think we could do the exact same thing with research. So I think, for example, why do we have people that we think have amazing research potential? They have great ideas, they're completely committed, and then they come in and we say, well, good luck in that clinical research arena, or in that research arena where systematically you have a lower chance of getting funded. If you are systematically, the topic area that you want to study is less likely to be funded by the NIH. Systematically, the institute that you are likely to apply for has a smaller piece of the pie at the NIH than another institute. So you have all these barriers against you. But we're going to have you come in and jump over all of those hoops to get funding to do the work that we agree is really great. So I would love to create some kind of like a similar type highway where you could identify these amazingly talented, high potential researchers and just say, listen, we're going to give you a great advisory group. We're going to make sure that you're in a rigorous environment to make sure the ideas make sense, that, you know, that the studies are high quality, but you're not going to have to jump through these hoops that we know are biased against you. You know, we might have certain metrics along the way, but, you know, the first 3 years, this is your funding. The next 3 years, you have this level of funding. Then this is when you get to your R level award. And maybe we won't have the median age of diagnosis, the median age of getting an independent research award at the NIH be 42. Like, this is ridiculous. We have people come in who are ready. And so I think that's the first thing that kind of came to my mind, and something that I've been thinking about is, why don't we have those kinds of programs too on the research side and not just on the clinical side? So yeah.
Okay. Let me see. Where do I start with this?
What do you really know?
Yes. Okay. I mean, I guess I think a lot about also the leadership development piece, because I think, especially here at the Hutch, that's a huge gap for us. I mean, if we look at our assistant professors, actually our assistant professor population is in fact now minority majority. About 12% are from underrepresented backgrounds. But if you go to our, and actually 45% I think are women. But if you go to our full professors, it's about only a third women and maybe 3% underrepresented and maybe 20% people of color. And if you go to our senior scientific leadership, meaning our senior vice presidents and above, it is actually majority women, but it's also all white. And so I think, how do we kind of leverage the kind of increased diversity that we're seeing in our junior faculty to a transition to leadership that will be successful? Because I think that's another part of this leaky pipeline, is where, you know, you can have, you know, that you don't end up seeing that diversity reflected in the ultimate leadership of an institution. And this is obviously a national issue. We have actually now a working group with all of the diversity, equity, inclusion leaders from all the different cancer centers. We meet once a month and share best practices. And I think there would be a lot of opportunities to try to leverage different things, that different innovative ideas that different institutions are having on a broader kind of multi-institutional scale, to kind of change the culture of academia, which I think is still in many ways quite traditional, quite hierarchical, and relies on really a meritocratic approach to promotion and advancement. And that's what really needs to change. And so I think I would probably try to figure out how to spend this money in a way that would have a broader transformation of the academic culture.
Yeah, so to get to your question, half part about leadership and development to bring about equity in cancer research. I would like to have a program that basically allows entry points at different levels of entry, ranging from students in high schools who are interested in cancer research or STEM or connects the two, to all the way up to faculty. And the idea would be to, obviously, I mean, the same program or the same specific material is never going to work for every entry point. But if it wasn't for an internship program that brought me from India to the US for 2 months, I wouldn't be exposed to the field of cancer research here and wouldn't be a faculty today, right? So having those entry points, like I did a mentorship program for high school students, and one of the high school students I had, she did so phenomenal. She decided to apply for the undergraduate in the same institution, came to do research with me again, and we published a paper together, right? And that was a research that continued from the final year of high school, right? So I think that if you're able to get entry points at different levels, we will be able to solve a little bit of systemic bias or incompetency that we have in the training pipeline. And hopefully there is going to be like a loop of mentorship, where senior faculty are mentoring junior faculty are mentoring postdocs or other trainees who want to become faculty, and they are postdocs and trainees who are mentoring grad students. And it's kind of like a loop. So that's how, and obviously that program would need research programs, funded programs within these individual levels, training, science communication, making them aware about what's happening in cancer research and engineering. So that's what I would do with leadership development. And the second part of it is research, where I think I'm an engineer, but really passionate about connecting engineering with clinical science. So I would like to have a platform where you can take innovations that are happening in engineering and work very closely with clinical labs for the translational side of things, particularly when we think about AI. I mean, there's a lot of things where when we try to do it, we look at the math, but when it comes to clinician, the first question is, what is it doing to my patient, right? So kind of bridging that gap, I think, would be the next big thing, and kind of using it not to solve every problem in clinical science, which cannot be, but to develop assistive technology. For example, I'll share this, PLFA, which is an organization which is looking at Burkitt lymphoma in Africa. We don't have as many experts in Africa to look at that many images to diagnose that disease. But what if we could provide them with a digital platform that actually rapidly navigates through those slides and is telling them, okay, this is where you need to focus, and these are the problematic areas. So that's the big thing that I would like to bring multiple researchers together on one board to connect engineering with clinical impact, particularly in digital technology.
All right. Unfortunately, time is up. But I could take one question. Eileen doesn't mind. No? Well, let's give our panelists a round of applause.
For my experience, I, in my first companies, would go to JP Morgan every year, the healthcare conference, and often be in a room like this full of all men and stand up and try to pitch our science to this room full of men. And that was really intimidating. I mean, it was really, intimidating. It's changing a little bit now. And, at VMS, we actually have a strong commitment to diversity at every level of the company, and it's not just lip service. It's actually happening at our board level. In the last 2 years, we've increased the gender diversity and the ethnic diversity at our executive leadership team level. It's completely changed just in the last 2 years, from almost all white men to now over 50% women, and in addition, underrepresented groups. So it's actually like they're stepping up and making it happen. When I started at Celgene, it was interesting. There were some stats about, really proudly showing that there was equal number of men and women at levels of the company, and the pay was quite similar until you got to a certain level. And then once you got to those levels that were really decision making, then the gender diversity really reflected a disparity between men and women. A lot more men in leadership roles, and the women sort of plateaued. And that was a real light bulb that was a reflection of the company, and at that time something that we had to pay attention to and try to change, because I think that's not uncommon.
Yeah. Right. So in our last panel, we talked about how the trends are going in the wrong direction in academic research, how more and more women oncologists, for example, are thinking of leaving if it's not sustainable. So, but maybe in industry that's different, because it's great to hear about what's happening at BMS. It's great to hear about Lyle has a female CEO, and it's changing in the boardroom now. So it's hard to imagine JP Morgan not just being a sea of suits, but
now, I'm sure.
Maybe
It
that's
still is.
changing too. Maybe women are wearing suits. I don't know.
Well, and the podiums are changing, but the investors.
Yeah,
Right.
and I didn't comment on CGen. I should just to,
Definitely.
it's a very similar, I mean, we've always had really strong women leaders at the executive level at CGen, or Seattle Genetics used to be. But it's now, I think, the commitment is even stronger. We've similarly, increased the diversity at the board level in terms of kind of racial diversity and gender diversity. And then at the executive level, definitely continuing to grow women leaders. I don't know if I'm supposed to talk about, if I'm going to talk about it, but,
Yeah.
we set goals these are goals for the company has, especially within the development group, that if you don't if we don't hit a certain number of women executives at this %, then you haven't hit your goal, and that impacts how people get their bonus. So it's definitely like they're putting their money where their mouth is. Like this has to happen, which I'm impressed. I think that's really important. I think we're definitely committed, and it goes beyond just the people who work at the company. And maybe we'll talk about this later, but we have a whole department now that is organized to improve the diversity of the patients we recruit on our trials and the investigators and physicians that we work with, to make sure we're getting diversity of thought, and then and the FDA is actually now mandating that we have more diverse patient populations, which is such a good thing.
That's great. I don't think I knew that. Okay, so we're talking about some ways that your companies are moving to greater equity and access and diversity. What about with pay transparency? I think, you might, can you talk about that? Or is there, I know Lyle is super interested.
Yeah, I'll just share. We actually have an external group that every year looks at leveling and pay for everyone, and they adjust pay, because it's well known. And we talked about negotiation at the last panel, that just historically women haven't negotiated, or don't feel like they can, or don't know how to, don't think about it. They just don't negotiate the same way men does. But it's also a systematic bias as well. Men come in better paid and they want a raise, so they ask for more. Women may be asking for more than what they made, but it's not the same as men. So when I first learned that some of my staff was going to be getting a raise because they weren't getting paid enough for the across the board, because they hadn't, and it was both men and women. So it literally is, for that level, for that group of workers, everyone is equalized. And so I think that's something that is fairly easily done if you level people in a meaningful way, and make sure that there's, the women actually get to the levels, or the minorities get to the levels as everyone else. So obviously that doesn't solve for promotion inequities, but as mentioned already, we have fairly good equity across the board at leveling in biotech. And so this was one way that they just made the money even without having to decide it themselves.
Is that unusual, or other companies?
We're doing it too.
Are you?
Yes, we do.
That's great. I wonder if anything like that is happening in academic research. Literally.
I mean, I think the key for me, the difference between academics is getting people to the level. So you have to, in order to have true equity, you also have to be promoting at the same rate and have those groups represented at all the levels. If at the previous panel someone was talking about space is equal, but if you don't have as many people at those higher professorships, then women have less space because they're at lower levels. And so I think that's the thing that we have to be careful about, is make sure that equity exists as well. And I guess it might be a time to share, one of the challenges is opportunity. So, there's a history of what it takes to get promoted. But if you don't have the opportunity to be on the panel or on the committees, or the leadership qualities, or the funding to get the papers out, you just systematically won't reach those goals at the same time as someone else. And so you have to look at someone coming in for a job differently based on what opportunities they've been given. And I've had the opportunity to be in hiring panels, especially for very senior scientists, where they're like, well, these two CVs, clearly this person is going to be better. It's like, I don't know about that, because that's the white male who has, the leadership and the 10,000 papers, and this woman who has, worked her way up and is probably interviewed better and maybe for our institution a better fit. But if you look just at the CV, you systematically see what happened academically, and don't take in those other factors that I think we need to learn how to take into account. And I don't know how to do that. How do you put value on those other skill sets that others have, whether they've had the opportunity or not to show them. I think we need to learn how to measure those and value them when we hire and promote.
I was just going to add that one of the things that we did at BMS was we instituted a training for interviewing and hiring. And we did this exercise where you got essentially blinded CVs and you scored them ranked on these different categories. And then we did the analysis of who would you pick. And we actually went around and found that this unconscious bias of people attributing sort of kind of these hierarchical traditional values weighted more heavily on some people than others. But then if you try to be more objective and look at it from a different lens, you ended up picking different candidates. And so we've tried to not only impose requirements for diverse panels of interviewees, but also diverse candidate slates, but then given our employees training on how to actually interview people and select candidates. And I think it's been really valuable in helping us increase our diversity of candidates and increase our diversification in hiring.
So that's the second time that you brought up developmental equity. Every time I have a question, I think I'm going to ask next. You already the conversation's there, and I'm like, okay, what am I going to ask next? Maybe I'll just pause and invite questions from the audience as per my pitch when I kick this off. If anybody has any questions, maybe online. Nothing offline yet. Okay.
So I think I know how to work this. So I'm Lauren. I'm with the ACS board as well. But I think one of the things that we've heard from a lot of women and also minorities is that sometimes they end up being a little bit overextended because they are the person that people are looking for, right? Like if you're the woman, I have a friend who works for Lilly and she's a female chemist. And they ask her to be on every single board because she's one of none, right? And so she just gets worn out by it, and that's not fair to her. So I don't know if I really have a question. I'm just like, have you experienced this, and what can we do to help with that, I guess?
Hire more women.
Yeah, it's a great question because even in trying to put together this symposium today, I felt it was, you just have, right, Cami Bell, I'm so excited that she came and they PK to thank for that. There's so few Black women in her role. Like she's busy and she's an oncologist. She's not putting herself out there as a DEI, consultant. Like that, it's true. You want to hear, see more. You have to change the perception, and so you have to see more people that aren't white, aren't male in these roles. But those people are busy. So it's kind of.
I would also say we should tap into people at every level of the organization. And I think we've tried to do that with some of our campaigns on just like promoting science and STEM and things like that, and not just people at the executive level or senior leaders, because everybody can be a spokesperson for diversity and inclusion and, women or underrepresented groups. And so I know we had after, I know today is the 2-year anniversary of George Floyd, or was it yesterday? But after that, we had a couple of people at BMS who we tapped into over and over again to talk about, racial, social justice. And those poor people were just worn out. And they finally had to say, like, okay, no more, like we need a break. And I would say the same thing for, for women that we tap into over and over again. It's like we need to broaden that spectrum. And we also, in our people in business resource groups, we encourage other people, men, to join the women's group and, just to kind of, again, bring diversity of thought. And so you don't just have to tap into the same people.
I love that example, yeah. And actually, I've been doing a few of these discussions virtually leading up to today, and I have my first man raised his hand from BMS, Doug Bassett, is going to do LinkedIn Live about this on the issue. And I think it's a really good point because everybody has to be involved in the conversations to get that partnership model, that diversity of thought that's going to advance research. So perfect. So maybe I'll ask about. So I think you mentioned Megan mentioned that the FDA is saying that the trials need to be more diverse. I'd love to hear more about that. When you're planning your R&D strategies and your plans are taking shape, are diversity and equity being discussed? Are there stakeholders from underrepresented groups involved in the discussion?
Yeah, I can comment on that to start. I mean, the FDA is now guiding that there needs to be a diversity plan for, at least for pivotal trials. So for trials that may lead to a drug approval, you need to make sure that you have a really representative population within the study, not just a bunch of, privileged white people that were able to easily get to the clinical trial site and have the resources to be able to travel back and forth so frequently. And so it's what it's caused us to do, which is what we were already working on it before, so I think we were in a really good place at CGen, was to really look at the patient journey and understand what does it take for a patient to come on a clinical trial, and what does a day in the life look like? Getting up at the crack of the dawn to drive 2 hours to get to the hospital because they don't live in the city where the phase 1 site is, and then they have to stay there for 8 hours and get blood draws, and then do they have to, maybe we can help by putting them up at a hotel that night locally so they don't have to drive back and come back again. And there's easy, simple things we've been doing for a while, but it's really digging deeper, like what else can we do to improve access? One thing that we're looking at doing, and this is just kind of an idea at this point, but I'm so excited I want to talk about it, is thinking, okay, well, what's something that's particularly relevant to the Pacific Northwest? And I know the University of Washington is working a lot with the Native American reservations to try to connect more with access to health from a public health perspective. But what about their access to clinical trials? And is there anything we can do on the sponsor side to partner with academic institutions to really bridge that gap? And because that's definitely an underrepresented minority that's very relevant in the Pacific Northwest. And so that's just one example, but I think we're really trying to grow internally kind of a group that's thinking about this 24/7, but also trying to create collaborations, both with patient advocacy groups as well as with academic sites.
Yeah, I'll just add, you really do have to be intentional about it. I think vaccine hesitancy is a perfect example of kind of racial inequities on trials, because you actually have to convince some of these populations to come onto the trial based on historical reasons they may not want to. And those are hurdles we have to overcome. And patient advocacy groups, I think, can play a big role in that. I also think, we, from a site selection and an investigator selection standpoint, may not choose the biggest academic centers, but actually more centers that still have complex oncology care, but they're not as academically centered. And so it's kind of more real world sites for some of our trials, especially when you start getting these transformative medicines, they become, access to care becomes a huge inequity because of the cost to the institutions. And so if you can get some of these big cancer networks, right, like US Oncology or Sarah Canada, these areas that they're these institutions that have a broad footprint into areas that have the diversity you need to do exactly what the FDA is wanting us to do and what the right thing to do is. So we are starting to intentionally work, frankly, with some institutions that you might not otherwise think to work with right away. And some of those become your best sites for accrual. They're excited to be involved. Some of these patients don't have access to a lot of trials, and so then you actually have more success than coming to the big cancer centers where there's 15 trials to choose from or 50 trials to choose from. So that's one way we've been trying to do it.
And I'll just add, in addition, PMS is doing similar things about increasing the diversity of patients on trials and access to our clinical trials, but also has committed to actually training clinical researchers and clinical research scientists so that the patients can interact with somebody that looks like them, so somebody they can relate to, as Kimmy was talking about before. that's part of the outreach that is needed. You know, having that connection to the treating physicians and having that, you know, relationship build that it doesn't exist with the sort of traditional model of these sort of very heavy academic centers and less diverse clinical trial patient populations. Having the clinical investigators also representing kind of that same diversity is really important. And I think that was, yeah, it was a really, I think, thoughtful plan that our leadership put together on both fronts, both from the clinical trial, but also the people leading the trials.
Right, because it's those relationships and building trust
Exactly.
that's really going to change the trend. So can I just, how is CMS doing, I mean, that sounds a little bit like they're funding academic research, or?
No, I mean, we have our own network of clinical scientists and clinical, Tina used to be one. So, yeah, so our clinical scientists, our clinicians, we're training and hiring from diverse patient pools. We also fund some academic studies as well, but I'm talking about internally our commitment to our employees.
Yeah, that sounds like a really important strategy. Okay, I have another question, and then I'm gonna open it up again to the audience. I was just reflecting, Terry, on what you said about, it's true, we could get, these panels don't have to always be the most senior leaders, and you know, it's great to hear from different stakeholders at all levels of their careers. But today we do have a panelist of senior leaders in their field. So I'm going to ask the question, you know, what advice do you have for people listening that are interested in, you know, following your career trajectory? And just, you know, how, it sounds like there's a lot of reasons to be encouraged about some of the trends in industries, but there's still the gender gap that gets growth with seniority. So, I mean, how do we sort of scale your example if possible? You know, like what advice do you have? Can I ask? Maybe we'll start.
It seems like a lot of the same themes, I think, come up. I think just by us being in front of our teams, they see it. And that's, I think, the biggest thing we can do is be the role models. And, you know, I think I'm in a situation where it's not a huge burden, and I feel like it's my role, part of my role, you know, to advocate for more of this and open the conversation, because I think the advice I would give to people is talk about it, right? So if you don't talk about the inequities, people don't see them. They just exist, and you don't even know they're there. And I think sometimes you just don't even know whether it's race, gender, or even just personal circumstances, you know, encouraging people to speak up to what they need. What do they need and want? And having those conversations and having a supportive leadership for, you know, hiring people that you're committed to their success. And so I guess my main advice is not to give up. I think, you know, don't be afraid to speak up and have hard conversations. It's one of the best skills to learn, is to have hard conversations when they need to be had.
Yeah, that's good. That's a good one. I think for me, something that I strongly feel is just to be an authentic leader, and I've really tried to set as a role model, you know, the example that, like, you know, you're not always going to be perfect. It's okay. You don't always have to be, you know, working 24/7. You're actually going to be better if you're balanced and you have a balanced life. You're not always going to, you shouldn't always need to be there for that meeting. You know, think about your entire life. And then if you set that as an example and you kind of normalize that, it's easier for people to see, like, you don't have to like miss every kid's soccer game because you want to move your way up, that you can have a balanced life and still do it. And it took me a while to get there, and it's something now I really try to normalize with my team, because I don't think everybody realizes how important that is. And you're going to burn yourself out if you don't heed that warning.
I think both of those are great. I would add maybe on the career development path is there's no one path that's right. And, your path might take different turns, but that's okay. And you might have to take a while to figure out what you want to do, and that's okay too. And I think, there's a lot of pressure in our society to overachieve and to be perfect and to get good grades and to get into this school or that school. But I think we have to acknowledge that people can contribute no matter what their level of training and no matter the path they take, because we have diversity not just in terms of gender, ethnicity, but also of backgrounds and training. And that's what really brings great teams together to be really productive. And I think that's the advice I would give. It's like, you don't have to have MD, PhD to be a great contributor. You can have a math degree or a music degree if you're interested in science and you can learn. We want those kind of people to be part of the team. So I would say just follow what you're interested in, and if that path is curvy, that's totally fine.
Okay, so I just have one follow-up question, if I may. I mean, this is all such great advice about having those hard conversations and being able to kind of show up as your authentic self and not feel like just a hype that you're sneaking out for your kid's soccer game or something, and valuing what everybody brings to the table. Was it hard? It was hard for you to get to this point, right? I mean, were there ever times where you couldn't have the hard conversation or didn't feel like you could show up as your authentic self that way and then sort of arrived at it with time? Is that a fair statement? Right? I mean,
you gotta work
right through that. Like, how do you get to that spot where you're like, okay, I feel better when I do this and there's no going back?
I think for me, it's being authentic. I think that resonates a lot.
Yeah.
And sticking up for what you believe in. I've left a couple jobs because the wrong values were being rewarded. Kind of that patriarchy had gone too far, and the wrong people were in the leadership positions. And when you do that, it makes a statement. And of course, I'm lucky because I had a job to go to. Not everyone can do that, but I think in small ways, even to stand up for what is right and say it out loud, because you matter and your opinion matters. My personality is such that probably maybe isn't as hard as it is for some people, but it's a skill I think that people need to learn. And as they were talking about at the last panel, learning your worth and your value helps you then step out and say those things. Because again, if you don't say them, it just gets perpetuated. And I think those of us that have made it here have to speak out and continue to point out when it's happening and make sure it doesn't continue to happen.
That's a very powerful one. I had a really simple, basic one. But I think of this example as like the microcosm of this whole thing, which is like, and it gets back to what I was saying earlier about work-life balance and drawing the line and drawing boundaries, because it's good for your personal life and your career and your sustainability. But I had, and you can attest to this, because there were so many times at work, back when we were in work in person, long days, where the people that had the ability to stay until late in the day and have those hallway conversations, that's like where the magic happens. And if you have a family and you need to get home and cook dinner for your kids at 6 o'clock, you're not going to be there for those conversations. And so I would sit and wait, like initially when I first started my career in industry, because I was like, I can't afford to miss these opportunities to get some face time with leadership and try to understand what's really going on and what are people excited about. And then I had, years later, I had a manager who had 2 young kids at home, and she, and a really good leader and mentor, she drew the line and said, I'm leaving at 4:30 every day. I have to go pick my kids up from, after school care, and I'm going home to cook them dinner. And every day she left at 4:30, no matter what was happening, unless there was a big emergency. And her career didn't suffer. She was doing great, and nobody cared. And she wasn't like not getting the cool assignments because of it. So when I had my daughter, and I started doing the same thing and never looked back. And it was like, why didn't I do this earlier? Why was I wasting my time trying to like hope to get this face time that, and I think that kind of boys club hallway conversation thing isn't as much the case, especially now that most people are working through Zoom in industry. But for some reason, that was like, it was a light bulb for me. That sounds like not a big deal, but I think it was representative of a mindset.
Yeah, I'll just add, I do think COVID has kind of leveled things and maybe reset values for people in a good way, right? In many ways about how we work and what we value in terms of, although I'm sure many of us worked extra long hours during COVID, right? You're just working longer hours from home. But I do think the expectation of being in person and being seen just to be seen, that has sort of gone away, and I think that's a good thing. I will say that I felt as a leader, when I was a leader of a team here in Seattle, I felt like it was really important for me to be here for long days and to be seen as being in the office and showing up and not being, the leader who can leave early or whatever. But I think that was probably not modeling the right behavior, modeling I would take vacation. I did model that. But modeling, going home at a reasonable time is a good thing. And so I do think having that appropriate work-life balance is a really important thing. And no, I didn't have it for a long time. And at some point I realized that's not a good thing. And other people probably appreciate it, that they see it differently now.
Yeah, I mean, bound to hit a tipping point, right? Enough people leave to get their kids' soccer games and sneak out. No, that's great. That's inspiring. Okay, are there any? Oh, you need a.
Indeed. Thank you so much.
Hi everyone, I'm Aurora. I actually work at Specificity Health with Eileen. Thanks so much for this great sharing. It has been very inspiring. I think one of my questions that I actually got from the career coach that I had before is that there's a saying that males tend to write 120% in their CVs, but females tend to write 70%, and that's a lot connected to this lack of confidence in ourselves. So I wonder from our experienced panelists, like what are your suggestions for, say, young professionals like me or other audiences from this event? Like, how do we fight against this, and how do we pose ourselves more confidently? Thank you.
Oh gosh, I don't think we've solved that problem yet. Even so, in July of 2020, I took this position as Chief Medical Officer and Head of Development at Weill. I had imposter syndrome. I'm like, oh my God, I cannot believe I'm getting this position. And I'm one of 3 clinical leads on drugs that have been approved for CAR-T. And I didn't feel like I was capable. Day one, I realized, oh my God, I can do this easily. And so I think it changes when people give you opportunity and believe in you. Frankly, Stan Riddell knew me from Juno, and he's like, you can do this. He's like, I saw you for years and years do this at Juno. You took it to BLA. Like, of course you could do. We need you. I was like, oh, okay. And I did it. And so I had someone believing in me, but I wouldn't have written my CV that way or gone in search of this position. And that's a problem. I don't know actually how to solve it. And that's where I think we need the community and frankly, the men to help get, and the racial majorities to bring the minorities in and say, we need you. And to have that intentionality of bringing women in that have been successful, that they know can do the job, because we don't necessarily think it of ourselves. And I'll admit that, at the highest level, I didn't think I could do it, and I can, and I'm doing it well. And that was fun to realize. But it is hard. I don't know how to teach it. I didn't even have it myself, so I don't know the answer.
I don't have any magical answer either, Tina. I think somebody once told me, you're so modest. Like, even if you felt like you were super bragging about yourself, it's just going to look normal. So I try to think about that as like, you can brag about yourself. It's not going to show out, and men do it all the time. So, you know, be confident. And confidence comes with time. It really does. You'll start feeling more confident, and then things just kind of happen naturally. But it's hard. I mean, imposter syndrome is real.
I don't have anything to add. Ditto. I mean, it's true. We're all, I think, in similar situations.
I actually was talking about this, so I'm so glad it came up. There was an article in the Harvard Business Review, maybe you saw it recently, called "Stop Telling Women They Have Imposter Syndrome." It's by Ruchika Tulshin and Jodi Ann Burry, and it's really, and basically, we've hit upon all of the points in our panel. I would say, you know, it's exactly, you know, where you're going with it, you know, in the beginning. It's that the answer to overcoming imposter syndrome is not to fix individuals. I feel like it's a, you know, pathological issue that we have where we don't feel good enough, but it's really to create an environment that fosters a number of different leadership styles where diversity of racial, ethnic, and gender identities is viewed just as professional, you know, as the current model. So I think it's all the things we're talking about. So maybe it is, you know, demonstrating good work-life balance and showing up at meetings and having those hard conversations, being authentic. And the more people do it, the less people will feel imposter syndrome, and the more women will start getting to 100% in their CV.
I like that a lot, because I think language plays a big role in what we've been talking about. Even using the word sneaking out to your soccer game. I'm not sneaking out, I'm going. and being and owning what you need and want. But we talk very differently. We say things people want to hear, and I think it gets back to authenticity. But I love it. People have put that word on it. I use it, but I love the idea of being, you don't know actually what you're capable of until your mentors and your sponsors actually help you get there. And that's probably true for a lot of men as well. I mean, we're talking about women because there's a systematic inequity, but I have no doubt there are men out there and racial minorities and even majorities that don't feel confident when they should. And helping people reach their full potential, I think, is all of our responsibilities.
Yeah, and that brings up another point. Deloitte did a study recently, and something like 40% of white men said they didn't feel a sense of belonging at work. So if you add that to women, underrepresented people, you're right, the majority of people probably would identify as not feeling a sense of belonging at work. So I think changing the culture, the rising tidal lifts all those. That's the way to go. So I think we're close to wrapping up and inviting Dr. Nora Desos up to the stage, which I'm super excited about. I don't if there's any closing words and final questions.
I'll try to make it quick. So I guess I know, like you were saying, that the hiring practices are changing and they are trying to include, more minorities or women, and that kind of thing. But I always, these events, kind of look around and I'm like, yeah, but we're the women who are coming to these events. We're taking time out of our work. We're kind of taking the load on. And so I'm just wondering, because in academia, when you bring this up, I mean, male advisors definitely roll their eyes, but I'm wondering if, like, in the executive room, the male executives also are secretly rolling their eyes.
Some of the women even roll their eyes, especially women. I have an example of, I think there's some generations of successful women who took on basically male personas to be successful, and I've had them tell me, there's nothing, you have it great. There's nothing wrong still. I'm like, what do you mean? As I'm sitting in a boardroom with 10 men and me, there is still a glass ceiling, and we do have to represent, that success, but it's small still. And so I think there's a lot of people out there that don't believe this is a real thing, which I think is why you have to talk about it more. And the old guard needs to get out. I mean, some of this is just going to take time, unfortunately.
But I agree, but I do think that awareness has been raised, and there are, as we've all talked about, our companies all have initiatives, and there might be people rolling their eyes, but we're still doing it. And so, you just have to push forward, and I think that's probably true of any of these major movements, in our history. So I think we just have to keep fighting. It's true, though, preaching to the choir is sometimes not very satisfying.
Yeah, for sure.
Well, first off, thank you all for taking the time to be here. This has been really great. We've talked a bit and touched on it, on the importance of mentorship and how much that's meant to everybody in their careers. Do you have any advice, especially for people earlier in their careers, on identifying really strong mentors and taking the most advantage of those relationships?
Putting yourself out there. I told a story with Nora. No, there are actually, at least within the industry, there's the women, I don't forget what the name is. There is an actual local group that pairs mentors and mentees, and people volunteer to mentor more junior people, both in industry, and I think it includes academics. And there are different programs kind of that train women in leadership and through SITC and other committees. So I think you just have to kind of look out there. There are programs, and otherwise just put yourself out there and ask somebody.
And I would say it can be informal too.
Yeah.
I don't think all these things have to come through formal programs. It's great when they have them, but just connecting with people and, having an informal discussion about your interests might lead to a job opportunity or, a reference to somebody else who might pique your interest. So I think that's part of it too.
I would say think outside the box as well. You don't have to stay in academics to get a mentor. Any sort of leadership, I think there's transferable skills that so if you can seek out people that way. Also have people help you find a mentor. Folks that know a lot of the people around your area of expertise that might be available, and they can help you even find a mentor too.
Do you have any questions online or any? Okay, we're good. Okay, thank you so much. You don't have to leave. So much. We're going to keep this relatively informal and stay seated. So now it's my pleasure to introduce Dr. Nora Desis, who said once when we were talking about this, what better way to support powerful women than to help brilliant female scientists change the world? I love that quote. Dr. Desis. We have Dr. Desis up front, so everybody online can see her. Aha. Oh. All right, so let me introduce you.
Can I sit there, or do I have to?
Oh, I see.
Yes, definitely. Oh, you guys don't get to go.
Everyone's clearing out. Do you want to introduce yourself?
Sure. Okay. I'm Nora Desis. I'm from the University of Washington. Thank you. I've been in academics for my entire career, and I do translational research. I studied cancer vaccines and have for 30 years. So I'm wrapping up. This is the wrap up. When I went to medical school, less than 20%, right, Julie, of our medical school was women. When I did my oncology fellowship, I was the only medical oncology fellow in my class. And it's nice that in 2020, 54% of women are in medical school. So we outnumber the men. And when you look at oncology fellows, about 45% are women, right? And we have seen changes in Seattle. I mean, we've got a woman president at UW, the first ever, and she's Hispanic and she's gay, and you can tell the culture change there. We have the first ever woman head of the Department of Medicine, just appointed a few years ago, in the 70-year history of the Department of Medicine. And we have more women deans there than we've ever had. So it looks like things are changing. But the more things change, the more things stay the same. There was a very disturbing study in 2020 in the New England Journal of Medicine, where a group of researchers looked at advancement of women in academic medicine from assistant to associate professor in the 80s and early 90s, and then a second cohort in the late 90s, 2000s. They looked at over 500,000 graduates from 134 medical schools. And what they found was, after assistant professor, at the rank of associate and at the rank of professor, in the early cohort, there was a big discrepancy in advancement between women and men. But in the late cohort, there was the same discrepancy in advancement. There'd been no change in 35 years in that whole period. I mean, there's no doubt that there is no bigger field where we need diversity than in medicine and biotechnology. Because we can't create life-saving or health-improving therapies unless we have lots of different people at the table telling us what's going to work and what's not going to work and represent their communities. And I'll give you an example. I said I developed vaccines. So I just happened one year to have a visiting professor come from Africa in my partner's laboratory. She studied HIV. So we did shared lab meetings that year. So I had one of the people in the lab presenting the manufacture of our vaccines in preparation for clinical trials, because people in the lab wanted to know the whole thing of how these were made. So as the presentation was going on, and then we got to discussion, this person from Africa said, "That's great. I'm glad that you're making something that will help rich white people, but it's never going to come to Africa. Number one, it's too expensive. You need a freezer. There's no freezers there. You know, and you're talking about a vaccine that would help a big population in another country. You guys have to think differently. You have to make it where I can put it in my pocket and it's got to cost $3. That's what's going to make things change." And we stopped, you know, because people go into research because they want to make a difference. And we halted and said, "You're right. We won't be making a difference unless we do a sea change." And we did a sea change, and it ended up with a whole different way of how we look at vaccines and manufacture vaccines. I don't think anyone in this room would argue that diversity is essential. It's been shown, increases productivity, innovation, it's disruptive. If you have all the people in the room coming from the same place, thinking the same way, all you get is incremental changes. And that is not what's going to help solve the big problems. We have to do something. We have to do something today. I edit a journal, and there are papers out the wazoo of the nth ways disparities are affecting people of color and women, from lack of getting paid the same to lack of promotion. There's a million things. But there's also nth research about all the different ways we can tackle the problem. It's out there. Why aren't we doing it? It's the same thing as that New England Journal of Medicine paper. If you go back to the 70s, people are saying the exact same thing in research, that we have to change to get diversity, as they're doing it in year 2020. In fact, I get these papers for the journal, and I'm like, yeah, I've heard that before. We need some innovation here. So the time is now. And everyone online or who's sitting here, obviously you're here because you have a passion for the subject. And the change starts with us, right? Someone asked me yesterday, as I'm saying, I am not the person to give this keynote thing. What would you do if you could do 3 things? Well, number one, women have babies, period. It's not a right, it's not a privilege. If women didn't have babies, we wouldn't have people. We also wouldn't have disease. But, you know, we'd not be here. I had a very senior woman tell me that if I was going to be a successful scientist, family was out of the picture. But I think that's the absolute wrong thinking, and I think things have got to change. Yesterday, I was watching TV with my kid, and there's a commercial, Amazon. A woman in a warehouse who proudly said, "Amazon gave me a 20-week maternity leave, and they let me go part-time for several months." You saw that commercial? Part-time for several months while I got my infrastructure in place to support me going back to work full time. And I said, that's great. Amazon really values their warehouse workers. Aren't we worth that? Aren't we in academic medicine as an assistant, associate professor, worth that as well? I mean, it's up to us to go to our leadership and say, this isn't working anymore. To ask a woman to come back after 4 weeks or on maternity leave, keep calling them up to do stuff because there isn't one filling in. So tied to that work-life balance is our promotion process that Chris Lee says has to be looked at. The academic promotion process has to be blown up. It's insane. It's non-transparent. I mean, what business would survive when they tell you people who don't even know you are going to get into a room and they're going to have to sign a non-disclosure agreement to never mention anything that goes on in that room? That's the academic process. And then they're going to make a decision about whether you get promoted or not. And the majority of those people in the room don't even promote you. It's time that all that ends. That was started in like the 1940s. It's time to move past that, be transparent, and reward people for what they do, their value to work, and have a pathway where people can take time off and come back into the system without being prejudiced by that time off. The second thing is, and this kind of gets to the last thing we talked about, we need a community for women. I mean, when I was young and first starting my lab, I mean, I couldn't throw a stone in the building and hit another woman scientist, right? Now, at least there are more in my building. But during those formative years, when you really needed someone to bounce ideas off of or tell that something is happening to me and I don't know how to deal with it, no one was there. And studies have shown more than having seminars or things like that, women need a more chronic support system. And it's up to us women to create that, not just once a year or once a quarter, but we need to have ongoing support for each other, whether that's a journal club, whether it's getting everyone together for a happy hour once a month, whether it's finding your junior person and your senior people and getting them together in a very specific, long-lasting relationship. So when those things start happening to you that you're like, this is kind of weird, microaggressions, or the reason why you feel like you have imposter syndrome is because you've had these subtle things happening to you for a long period of time, saying that you're not really like other people. If you were with a group of women, we'd be able to say, it's happened to us and ignore it. So we need to get these young people at the very early stages of their career and nurture them more closely. And that's up to every woman and man in this room who's interested in this topic. And the final thing is, we have to get women on the invisible path to leadership. And what is that? Yeah, you can apply for stuff, that's good. Those are the big things. But there's a million other things that get you to the place where you apply for the big things. So for example, when a new Department of Medicine chair comes in, they get to appoint their team. These are appointments, it's whoever they want. And what do people choose? They choose people that look like them, that feel comfortable. They're going to have to be in a room with them 8 hours a day. They're going to choose people that they want to have lunch with. And I'm telling everyone in this room in a position of power, get your Rolodex. Go to the meetings and see those people who are underrepresented, the real bright stars, and write them down. I have like 50 of them. I have a piece of paper in my office where I collect them. I make sure they write editorials for the journal I work with. I make sure I recommend them as speakers at meetings. I make sure I recommend them to do other things within the university because I was lucky enough to get to the point where I have a leadership role. So fill those invisible path to leadership positions with people who are underrepresented in science so they can learn to be the next leaders. and bring that diversity we so sorely need. So I think the time, COVID has showed us, we can change our system. The problem is it's slowly going back to status quo. We have to go beyond status quo. We can't go back to the way it was before. And some of the changes that came with the pandemic were very beneficial for women and underrepresented minorities. So we can't have this anymore be talking points. We now have to take action, and that's up to everyone in this room and everyone online. So I'm pleading with you, let's make those changes permanent and go even further than what the pandemic brought us. So do you want to comment? Do you have any questions you want to bring up about that, or just overall about what you thought of the afternoon?
What are some changes, like, from the pandemic that we should carry forward? Traveling?
Yeah, so for instance, when women have young families, it's very hard to travel. And it's not like you can bring your kid into the meeting, right? Right away, as soon as most of the universities lifted their travel restrictions, immediately there was, let's get back to it. Can't wait to be back in person, because the magic happens when you're together. You know what? I've been on many Zoom meetings where the magic happens. That's not a big deal. Of course, there are network availabilities, but, medicine and science have become so specialized. We're not talking about the one big major meeting of the year. Literally, if you want to be seen, if you want people to hear your science, you're traveling every month. That is just not possible for junior women who are just starting out and having their families. So I do think we need to not run away from some of these things, like many of my colleagues are going, can't wait to get back on the plane. Let's try to make meetings work in a hybrid way. Let's try to have more meetings where people can do it from home. For women, let's say, we've seen COVID, telemedicine, people were not going into work. They were seeing their patients by telemedicine. Why can't we have extended maternity leaves and let physicians who have primary practices like that practice by telemedicine with an extender? I mean, we did it. It worked. They've changed the insurance policies to allow it to work. So these are some of the things where we had to think out of the box because it was an emergency. If you value diversity, leaders of organizations, continue to think out of the box because it is an emergency. Will there be CAR T-cell therapy given in, Sitka, Alaska? We gotta have people in the room to say, help us here. We're going to develop so many therapies that are just not going to help people unless we have scientists at the table who speak for their tribe. I'm being old ladies.
I have a question. We are at a time where collaboration is definitely needed between multidisciplinary teams to advance science and research and development, drugs, technology matter. It's beautiful to achieve, I don't know what would be an ideal percentage of women in science in cancer research. But do you think it may be a possibility, a good possibility that female and male researchers would cluster and eventually the cooperation and collaboration would be deteriorated at some point? I don't know, I'm just curious because it's important to have support from female researchers, but at the same time, I believe discoveries and advances require, engineering, biostatistician, drug discoverers, computer scientists, bioinformaticians, and you name them. Today, the teams are multidisciplinary.
Yes.
And the skill sets are booming, are expanding in terms of turning a musician into a scientist. I would be curious, how would you approach that and how would you help such a person? So, what do you think?
I do
Are
think
going to see this division?
when you talk about teams, like I think academic medicine has changed. I mean, I think we've gone from the lone wolf. I mean, most of the lone wolf lab heads are of another generation. I think most people who are of a younger generation are really trying to put together a team approach to laboratories. That's why you see an increase of centers or institutes or things like that on the UW campus. And I think UW, compared to the Hutch, is more flexible in terms of being able to create teams of people. And I do think, men and women working together, some of these things we talked about, like imposter syndrome. I'm an associate dean at the UW, and I talk to men and women equally. And I think a lot of the problems that we're talking about for women are also problems for men as well. They just need a place to talk about it. And when I talk about support for women, I'm really talking about an emotional support for women, because I still think for men, you can go over to my lab at the Brotman building, and we've got a kitchen and a table where people have lunch. And when you go into lunchtime, you'll see, 15 men sitting there around the table gabbing of all ages, but there will be only a few women. Sometimes it's because the women have to do work and they're the ones that are cutting the time off and saying, I'm leaving at 4:30 because I got to pick up the kids. But sometimes it's because there isn't enough women on the floor to be able to have 15 women around a table, right? So I think that it's good and it's a must to develop that type of support for women, since it can't be happening in the workday because we're not all co-localized in the same place. To think out of the box and find ways that we can provide that spontaneous interaction that will grow into a relationship that will allow women to ask questions like, how did you negotiate being this? Or how did you get on that career pathway? Because I could say how I did these invisible steps. You've got to advocate for yourself. I think that happens more spontaneously for men because they're more spontaneously around each other than women, because we're a little bit rarer in the environment.
Would you sign a non-disclosure agreement for an interview?
No, I would never sign any non-disclosure agreement. That's why I don't go to the promotion committee meetings.
Well, thank you so much, Nora. Fantastic. Thanks to all our